This is Suzanne Swank, student number M1712220COS. I am doing practical lab number 2, determining patient consultations for glucometer use. Okay, let's begin. Good afternoon, welcome to Lakeview Pharmacy, sir. May I get your name, please? Okay, Pablo Herrera, and your birthday, sir. 8/12/1962. Okay, thank you. And can you confirm your address for me? Yes, I do have 2250 County Road 15, Pocatello, North Dakota, 58002. I do have a few prescriptions here for you. They're ready for you. One of them is your glucometer, and I will go over how to use this and how to clean this with you right now real quick. So first we're going to open the box. Well, before we open the box, your glucometer itself will expire March 20th of 2026. The expiration date is here on the side. We're going to open the box. It comes with 10 test strips. They expire on March 20th of 2026 as well. Has a control solution, which has an expiration date of May 31st, 2026. And then we have your glucometer itself right here. I'm going to take that out of here so I can go over with you how to use it. And then we also have a carrying bag to carry your glucometer and test strips and all of that with you in. The owner's booklet, a quick reference guide on using your glucometer, a log booklet for your test results when you take your glucose readings, an instruction guide on how to use your lancing device, the lancing device itself, sorry about that, and some lancets which have an expiration date of April 2nd, 2029. All right, so the first thing we're going to go over is how to use your new glucometer. In order to use your glucometer, you will use these test strips. Let's go ahead and open these up. And get a test strip out. So I can show you how to load it into your glucometer. And we're going to go ahead and take out a single lancet. So I can show you how to load them into your lancing device, sir. Okay, so the first thing you're going to want to do is you're going to want to load a lancet into your lancing device. You pull it apart right here. The arrow comes off from where this little button is. You load your lancet into this slot here. And then you're going to want to twist the tip of the lancet off. Comes off like that, and then it will give you a small little needle, which is what will prick your finger. Put the cap back on here. Set it to 1 or 2. Set it for 2 for these purposes. You'll want to get a test strip out. Make sure everything's at room temperature. Insert your test strip this side up into your glucometer. Pull back here, and now it's loaded and ready to prick your finger. Take an alcohol prep pad. After you wash your hands with soap and water, take an alcohol prep pad and whichever finger you're going to test on, clean it really, really well with the prep pad, just to make sure there's no kind of residue or anything else on there. Let that dry, air dry, don't blow on it, just let it dry. And then once it's dry, you will hold the lancing device up against the side of your finger. Press the button. It will push the lancet out. Prick your finger. You'll get a little drop of blood. Add it to the little testing strip here. And in about 4 seconds or so, you will have a glucose reading. And then you can log that in your logbook. To take the lancet out of the lancing device, you should use a new lancet every time you test. Just put the blue cap back on the needle very carefully. Pull it out and dispose of it in a sharps container. Within the 4 seconds, your meter should give you your glucose reading. Go ahead and put all that back in here for you, sir. And the control solution, you will use a test strip with that as well. You'll load the test strip in. Take your control solution, put a little drop of your control solution on a piece of aluminum foil or plastic wrap, and let the test strip suck up that droplet, and then you can compare those results to the results that it says on here. You should do that when you open a new box of test strips, or if you feel the reading is way off, it's way higher or lower than it should be. It'll just kind of tell you if you're testing properly, if your glucometer is still working properly. All right, then we're going to put, and then it can all go in your little carry bag here, along with your logbook, extra alcohol prep pads, your glucometer, your lancing device, extra lancets, your test strips, and your control solution. It'll all fit in this little bag for easy carrying. Okay, and to clean it, you should clean it about once a week at least, or if it gets really dirty or anything like that, you need to make sure you clean it. Wash your hands with soap and water. Take an alcohol prep pad, clean all around the outside of this, and the same with your lancing device. Allow it to air dry. Same with your lancing device, clean all on the outside of it. Take it apart here, swipe along the inside of it in here with your alcohol prep pad, and all along here, use a different alcohol prep pad for your lancing device than you use for your meter. All right, and that's how you use that. Do you have any other questions on the use of this? You don't? Okay, awesome, great. I will go ahead and get this packed up for you, sir. Do you have any questions, any other questions you might have? You're suffering from low blood sugar you think it's due to your medications. All right, well, I can definitely get the pharmacist for you. The pharmacist can help you with that. Let me get this all packed back up for you and put back in your box. All right, now let me go grab the pharmacist for you real quick, sir. I'll be right back. Hello, Mr. Herrera. This is Pharmacist Greg. He will be able to answer your question. Pharmacist Greg, Pablo Herrera here we went over how to use and clean his glucometer, and he had a question about one of his medications. He thinks it is causing his blood sugar to go low. He thinks he's having an adverse effect from it. So I told him that he could speak with you. So you guys Mr. Herrera, have a wonderful day. It was a pleasure seeing you today, and I look forward to seeing you again. Thank you.